This video will introduce you to the key aspects of the newborn physical exam, with a focus on normal physical findings versus those that might suggest a congenital anomaly or genetic condition. When you enter the room, congratulate the family and introduce yourself. Explain that you would like to examine their infant and ask if you have come at a convenient time. If the family agrees to an exam, carefully place the infant on her back and unswaddle her from any blankets. Make a general observation of your patient. Is she asleep or awake? Is her skin warm or cool to the touch? Are her vital signs within normal range? Is she having any difficulty breathing? If you note any signs of distress or illness, end the physical exam here and notify the supervising resident or attending physician. If the baby looks well but is crying, console her by laying your hand on her head or offering a pacifier if the parents allow. Proceed with the individual aspects of your exam. The simplest way to examine a newborn is from head to toe. By using the same method during each exam, you will be unlikely to leave out important steps. Head. Gently place a hand behind the posterior portion or occiput of the skull. Measure the head circumference in centimeters by wrapping a measuring tape in a circle just above her eyebrows to the most prominent aspect of the occiput and back again. Determine if her head is of normal size by plotting the circumference on a newborn growth chart. The head circumference should be in the average range for infants of the same gestational age and also fall approximately in the same percentile as the infant's length and weight. Next, what is the shape of your patient's head? A newborn skull is made up of several bony plates that meet along flexible cranial sutures. In the center, they form a soft spot known as the anterior fontanelle. There is also a smaller fontanelle in the back, the posterior fontanelle. The first letters of the cranial suture and fontanelle spell out the word clams. C is for coronal suture, L is for lambdoid suture, A is for anterior fontanelle, M is for metopic suture, S is for sagittal suture. This design allows the skull to be malleable enough to fit through the birth canal, which often leads to a temporary deformation called molding. Check the infant's skull for bruising and swelling. A bruise that doesn't cross the suture lines is called a cephalohematoma, which is caused by bleeding below the periosteum